Welcome, Vanessa. It's such a pleasure to have you here today.
Thank you, June.
Now, I understand that you recently joined Calabash Internal Medicine. What brought you to that practice, Vanessa?
Yes, I did join Calabash May the 1st of this year. After my husband and I relocated to the coast from Charlotte, North Carolina. I had been with Novant most of my career.
Really?
And when I saw the Calabash practice and met Dr. Moretti, I knew it was going to be a good fit, and so that's how I landed there.
Oh, well, that's wonderful. So had you moved here first and then found Dr. Moretti's practice, or did you know about it before you came?
I did not know about it before I came.
Really?
We had bought a home last June on the waterway for a vacation home while we lived in Charlotte, but we had our home on the market in Charlotte, and when it sold, we just decided that we would follow our hearts to the beach, and it all worked out, and so that's how I landed at Calabash Internal Medicine.
That's wonderful. Great story. Well, I'd like to start off by learning some more about you, about your background and your education, things like that. Let's start off where you went to school.
Okay. I entered nursing school right after high school at Presbyterian Hospital School of Nursing.
Wow.
I graduated with a diploma in nursing just about the time that diplomas in nursing became obsolete. So my next stop was Queen's University.
Oh, great school.
In Charlotte, and that's where I got my bachelor's in nursing. And it was actually in that program that I began to fall in love with nursing and really embrace the professional aspect of nursing and realized how many options there were, and enjoyed consuming research and kind of understanding all that, how that could mold practice. And then after working a year or so with my bachelor's, I decided to go back and pursue my master's. So I did that at the University of North Carolina at Charlotte. I got a degree, it's adult health nursing, and I took the certification exam to become an adult health nurse practitioner.
Wow, it was a long, long trip to get where you are.
Well, I call it the scenic route. I mean, the scenic route. I did take the long way there.
And we're so glad that you did. You said you moved from Charlotte. Are you a native of Charlotte, or are you originally from this area?
Well, I was actually born at Presbyterian Hospital.
Really?
And actually grew up close by in Mooresville, North Carolina.
Sure, I know where that is.
And but then when I came to Charlotte to go to school, I stayed, until just this February.
Really?
We actually sold everything in Charlotte and came down here full time. So no, this is a new adventure, a new adventure.
The next chapter of your life.
Yes, yes.
And what made you join Calabash Medical Center? Was it the practice and Dr. Moretti? He has such a great manner about him. I'm sure that had a large part to do. Is that the kind of practice you were looking for?
Yes, because, I've actually worked in family practices before.
I see.
But because I am an adult nurse practitioner, sometimes by accident people would put children on my schedule, and I wasn't trained to do that, so it was always just a little inconvenience for that to happen. And I thought ideally internal medicine would be wonderful. And so when I saw the Novant practice in Calabash, about the same time, one of my neighbors told me that he saw Dr. Moretti, and he just had all kinds of really good things to say about Dr. Moretti. And sure enough, when I met him, we clicked. We are a terrific team. We have a good time together, and we have very similar philosophies of health care and patient care, and we have a really nice time practicing together.
That sounds wonderful. It sounds like a place I would want to go. For viewers out there who may be new to the term, explain what it means to be an internal medicine practice versus a family practice, for instance.
Well, the obvious difference would be the age of our patients. We take care of adult patients, and also sort of specialize in adult care, and even to the geriatric years.
Really?
Our oldest old. You know, there are certain conditions and diagnoses that tend to occur at certain ages. So you have the pediatrics that take care of the children, and women's health care specialties, but our specialty, internal medicine, is for adults and our elders.
Well, that's really helpful, Vanessa. And going along with that line of thought, tell us about some of the types of services and procedures offered at Calabash Internal Medicine.
Well, we provide ongoing care of patients with chronic diseases such as diabetes, hypertension, arthritis, things along those lines, the chronic diseases. We also provide acute care when someone just gets a sinus infection or a stomach ache or something like that, back pain. We have a lot of patients who need those services. We do keep some appointments available each day for patients to call us, and we can work them in.
Oh, same day?
Same day. We anticipate that with our patients because...
So if I'm a patient of yours and I've cut my finger, and I can just give you a call. I'm chopping onions or something, and I can just give you a call, and you'll see me that day.
Well, we
provided I'm a patient of yours.
Exactly. We do save spots on both my schedule and Dr. Morecci's schedule for that.
Wonderful. That's great. Well, I'm curious, are there other, do you remove sutures and things like that?
We do. We suture and remove sutures. We inject joints. We do EKGs, pulmonary function studies. We have a laboratory on site.
Oh, you do?
We do.
So you have the results right away?
In some cases, we do have results right away, but we partner with a national lab, but the blood work is, the blood is drawn specifically for what we order in the office. So the patient doesn't have to go to another place to have their blood drawn.
Right.
We provide...
well, do you provide women's care? Because I know that a lot of times you have to go to 2 or 3 different physicians to get, being a woman, you might have to go a couple places to have certain things done. In terms of that, what kind of services do you offer?
Well, we do now provide women's care.
Really?
That's one of my areas of interest. I really enjoy working with women to keep them healthy. I do pap smears, breast exams, do sort of a well woman visit where we just kind of go through all the recommendations based on her age, and I've found our patients are very receptive to that.
I'm sure they are, because it's so much more convenient for them to have that all done in one place. And then you have the total picture.
Exactly.
You can better care for that patient because you've got all the information. That's a great, great service to offer the women of Brunswick County. And this time of year, I'm thinking about immunizations. You know, we're getting into the fall. Talk to me a little bit about what immunizations you might provide at Calabash Internal Medicine.
Well, several are recommended by the CDC.
Really?
We provide pneumonia shots.
Oh yeah, I've read about that.
We provide flu shots. We recommend and write prescriptions for our patients to get the shingles shot. Patients over 60, the CDC recommends a shingles immunization.
Is that connected with chickenpox?
It is. It's if one has had chickenpox at an early age, we would be at risk for developing shingles later.
I see.
Our immune system keeps that virus in check, but sometimes we go through a period of our life where we're under stress, maybe some illness or something stresses the body, and the chickenpox virus reappears as shingles. So the shingles shot drastically reduces the chance that that would happen by boosting our immunity to the chickenpox virus. The CDC also recommends that adults get a pertussis vaccine, and that comes packaged. We get it at least once in our adult life. When we need to get our tetanus booster, the CDC recommends that it be a tetanus that also includes pertussis.
Now, what is pertussis? What does that?
Pertussis is commonly known as whooping cough. And nowadays we're seeing little outbreaks of whooping cough, sometimes because people are not immunized as recommended for various reasons. And
if you had whooping cough as a child, might you be able to catch it again in your adult life if you're not inoculated? Or
well, whooping cough is not, most of us haven't had it. It's something that would be a little rare, but the antibodies to whooping cough are not as enduring as some of our other antibodies.
Really?
So we had to have the vaccine when we were children, but the thinking is that those antibodies have disappeared, and that's why we need to re-inoculate ourselves, boost our immune system to learn that antigen so that we can fight whooping cough if we get exposed to it.
Would that be a one-time shot like pneumonia you get at once?
We do. That's what we think, and I'll have to say that the recommendations do change, so stay tuned, but as of today, that's what the CDC has recommended.
Now, if you admit your patients, I'm assuming you admit most of those to Brunswick Novant Medical Center, and do you utilize the hospitalist services there at the hospital?
We do, we do. And I have had an opportunity to work with them a couple of times since I've been here, even in this short time period, and they're wonderful. I can so easily get them on the phone, explain what's happening with our patient, and we get them seen very quickly, and there's good communication between our office and the hospital. So nothing but the highest praise for our hospitalists.
That's wonderful. Now the big question is, are you currently accepting new patients?
We are accepting new patients.
That's good to know, because a lot of the practices in the area are closed. They just have so many patients, you know, they have to stop taking them at some point. And so it's good to know that your practice is open for new patients.
Exactly.
And so if one of our viewers would love to have an appointment with you, how might they do that?
Well, our number they are welcome to call is 910-579-8363. We're right in downtown Calabash. Easy to see us. We're right across from all the restaurants.
Oh, well, that's an easy that's an easy way to find you. And they can just ask to have an appointment with you, Vanessa, and or Dr. Moretti.
Correct.
That's great. Well, Vanessa, I've really enjoyed meeting you today. It's been a pleasure to have you. I hope to have you back real soon, and we'll talk about some of your special interests.
Thank you, June.
Great.